Thank you, Nivi, for the warm welcome. And welcome to everyone here, and welcome to those of you listening on Zoom. It is an absolute pleasure for me to be here. Very early on in my career, I went through burnout. And I felt at the point when I went through burnout, there wasn't as much info available on burnout. I didn't want to do medicine anymore at that stage. I had a baby and a small toddler who I had to care for, so I didn't really have the option to quit medicine, which I would have done if I didn't have anyone to look after. So I realized that I really needed help, and I needed help to become a good doctor again and to be a good mom, to be a good human being. So at that stage, we had a lot of resources to really help us with depression, to help with mental health, but not really anything for burnout. So I've really gone on a quest to find help, and I've really been fortunate to work with incredible physician mentors that you are very well familiar with through the Physician Leadership Institute that helped me recover from burnout, and I've made it my passion since to help other people with these basic steps that I used in my life to recover from burnout, to implement that in their lives to recover from burnout. Then last year, I opened a wellness clinic. So with this wellness clinic, my goal was to help people, especially the people that we see in hospital. You know how often we see people with illnesses they could have prevented, illnesses that can be prevented with a different lifestyle, different diet. So that was really my goal, to start a wellness clinic to help prevent physical disease. But very fascinatingly, most people who came to me were people suffering from burnout, and many of them were physicians. But they would only recognize burnout at a point when it affects their physical health, and that's when they would come to me. But it doesn't help if we just address all the symptoms. We really have to address burnout. So I would like to share this with you today. And if you can, even if you can just take one thing of these 10 strategies that I'm going to discuss with you today, if you can just take one and implement it in your life, just to become 5 to 10% happier, that would mean success to both of us. So Yoram, you can go to the next slide. So first I'd like to mention that physicians really objected to the term burnout. When I've been working with people and now someone has developed this autoimmune disease and they just hate their job, and I was asking, but couldn't you maybe have burnout? A lot of people really felt that the word burnout might imply that they're not coping as well as their colleagues with the same amount of work, and they thought that maybe it meant that they have a flaw inside of them, that there's specific one physician that I worked with, both her parents are physicians. And she really felt flaw, the fact that she can't cope with an amount of stressors that both her parents from an older generation are able to cope with perfectly well. So I'd like to address that burnout is not really something self-inflicted. It's really something that's identified by the World Health Organization. I'll read this. It's the end result of prolonged moral injury from trying to function in a system that prevents you from doing your job well. That are things like an EMR that's working against you, or system issues when you're a physician and you want to cut out a cancer now, but you don't have OR access. There's rules outside of your control that you can't do that surgery now. You see the patient again 6 months later when this cancer has spread, and now this patient is stage 4. It's too late to do anything about that. That causes moral injury, which is another big topic, and I have a podcast on that as well. And I'm also not even addressing moral issue. I'm really limiting this to burnout, something that is caused by a systemic issue, and how do we cope within that issue. And me talking to you today is not going to fix our systemic issue, and I found that when I've done this workshop to people in corporate, where they find that, and it was quite interesting to me, I've always known that we had these challenges in hospitals, but there are so many big companies out there where people go through the same frustrations, where they're overworked, where they have multiple job descriptions that they have to fulfill, and they feel they don't have the resources. And then when I show up with a workshop, they feel HR shouldn't throw a wellness course at them. HR should rather get more people to do the job. Right, so I want to really address that I'm not treating the systemic issues here that is causing burnout. I'm advising us on skills, how to cope within the system while we advocate for change, which is important. You can go to the next one. So, just as Nivi mentioned, we have all these statistics that many people have suffered through burnout, many physicians in their career. And a lot of us don't necessarily realize that we go through burnout. So I want you to pause and to reflect and to think in your own life if you can identify if you've ever gone through burnout in your career. And then when was that? So burnout is characterized by emotional exhaustion, depersonalization, and a loss of empathy. And then you can also think when in your career were you really at your happiest? And try to reflect on that why. What was different? Why were you happier then than now? And it's very important, there's no physician blaming, there's no blaming to yourself that you can't cope. It is more recognizing this loss of empathy, this depersonalization, so that you, before you start developing physical symptoms, that you can recognize it and address it. So I'm going to discuss with you today 10 steps that you can easily do in your own life to address burnout, to heal from burnout, and to prevent burnout. So the first one is to practice self-compassion. You know how you are kind to everyone around you, your patients, your children, your friends, when they go through something hard? It's so easy to be kind with them, but we typically tend to be very hard on ourselves, very critical on ourselves. To yourself, you will easily say things like, "Oh, that was so dumb." So I want you to recognize how you speak to yourself in your mind during the day. And is that really the same way that you'll speak to a loved one? The evidence show that you will feel better if you practice self-compassion. And it's a skill, like anything else, that you will get better with practice. So early in my journey, I read a great book by Kristen Neff, where she spoke about self-compassion. And she gives all the statistics that they've shown, research that they've done showing where they teach people compassion, how these people, when they become more self-compassionate, they start showing more compassion to other people. So you don't only become better towards yourself, you become a better doctor and you become a better human being. So that's very interesting to understand that, because I always thought not to be soft on myself, to be hard on myself, but the science really shows that when I'm more self-compassionate, I'm going to be a better doctor, and that was a game changer for me. And if you don't have time to read through Kristen Neff's whole book, you can watch her TED Talk on YouTube. It's really very, very good. So as you start practicing this, and it doesn't come easy, it really took me years to really stop all negative self-talk in my own mind, not to criticize myself at all for anything. And then as my criticism and negative self-talk stopped, I could really see how I literally became a better doctor. I used to, in family practice, if patients tell me, oh, they need more sick leave, or they need disability, or they're not coping with their stress, I wouldn't understand it, because I would be able to cope with much less sleep and way more stress. But with time, you get to a point where you can sit there and you can look your patient in the eyes and you can see your patient's situation through their eyes, with their frame of reference, with their resources that they have available to them. So step one, start noticing that dialogue in your head. That's already a win if you notice, because a lot of people don't even notice what they're saying to themselves during the day. So start noticing. And when you recognize something negative, replace it with something positive. And then even if you think you're not worth it, do it for everything around you, for everyone around you. Step two, yes?
Sorry, Daniela, I don't know if it's going to come in your subsequent talk. Can you elaborate a little bit about depersonalization?
Yes. So with depersonalization, people kind of feel detached. They can often feel like things are happening, but that they're not as involved. Say, for example, our department meetings, we are very passionate. This must change, the system must get better. Then at a point when people become burned out, they kind of feel that They're not contributing, they're not making better. You'll notice your colleagues that are becoming very cynical, they are the people also not showing up at department meetings. They feel that they have a hard time connecting in close relationships. When I speak to these people more privately, they would say that they don't have that ability to connect with their family. And we'll get to that later on to say, what are you doing that is fun? How do you fill your cup? And these people don't know. They're just so disconnected from themselves, from their bodies, that they don't know what makes them happy, what makes them sad. They honestly don't know. Step 2, realize your value. All of us are born with tremendous value as a human being. But this is something that physicians really struggle with. We often we feel that our work value and our human value are connected. And your job matters, of course. If you want to heal everyone and run an amazing department and write lots of publications and do lots of philanthropic work and win awards, good for you, but it doesn't make you any more worthy. When we take the pressure off of hustling to increase our own value in our own eyes, life gets a whole lot better. You can still sit on committees and volunteer at your kids' school, but you have to do it with the realization that doesn't add any to your value. And then also, if you're not as great doctor as you hoped you would be, that doesn't distract any of your human value. Step 3, learn to say no. That's also something that's very hard. Our socialization and our medical training has rewarded us for other people to like us, to tap us on the back and to say, oh, you're a wonderful doctor. So that did lead to our success, most definitely, but that also leads to our harm. It comes at our own expense. Every time when you say yes to one more thing, what are you saying no to? Quite often, when you're saying yes to work, to your colleagues, you're saying home to your family. You're saying no to your home life, to your family. Or when you're saying yes to your family, being a cook and a chauffeur and a rockstar cleaner in your house, you're saying no to yourself. So to be very intentional and to learn, same thing, over time, it becomes easier to learn how to say yes to yourself and no to everything else. Next step, number 4, is to reframe your situation. So we are trained as doctors to always consider the worst case scenario. If a patient comes through emerge with anemia, we immediately think this patient needs a whole malignancy workup. When your patient has a bit of a calf strain, you do a full DVT. You treat it as a DVT until the ultrasound rules it out. It makes us phenomenal doctors, but not so great humans. Even if my toddler gets a fever, I would immediately think leukemia, meningitis, which is good when you're a doctor, not so good when you're a parent, when you're just a friend. And everything that has happened in our past and every situation that we are in now, we can reframe. We can reframe our situation. I'm not saying you should be an eternal optimist and ignore reality. Not at all. What I'd like you to encourage to do is to find something positive and to focus on that. It's much easier to notice negative things and shortcomings, but I would like you to focus today on finding something positive in your work, something positive in your family, and to shift your focus to that. So, and that is also something that you get better at. So when you get home today and your kitchen is all messy, rather than seeing just the mess in the kitchen, you can look behind that and you can see, oh, your partner cooked dinner and be grateful for that. Or at work, when we do get frustrated with certain systemic issues, you can go and intentionally find something that is working well in our system. You can be grateful for our system being so robust that you can take a week off to recover. We have many things that we can be grateful for, and when you shift your focus there, your energy will flow there as well. It doesn't mean being happy with what you have and stopping there. I'm all for creating a bigger, better version of yourself, but focusing on your own positives will get you there faster. Step 5, breathe. So that is a big thing that I deal with in my clinic, and there is an excellent book that you should read by Gabor Mate. It's a Canadian doctor that wrote When the Body Says No. We deal with a very big amount of stress for very long, and our brains think that we can continue to deal with this indefinitely, but at a certain point, your body is going to stop coping with this amount of stress. Every time when you're stressed, when you read the news and you see another shooting, your body secretes adrenaline and cortisol. Your body can't really distinguish whether you've been in that situation yourself or if it is just something in the news or just something at work that's frustrates you. So continuously, your body does secrete adrenaline, cortisol. All of these things increases our risk for autoimmune disease, heart disease, for cancer. But when you stimulate your parasympathetic system, you counter that. And the easiest way to do that is with breathing. When you do deep breathing exercises, you stimulate your vagus nerve, your parasympathetic system, which counters all your cortisol and adrenaline. I'd like to teach you something which I teach my patients. I've taught it to kids, but you need to stand for this. It's a very simple breathing exercise. Thanks. Yoram, you as well. Everyone needs to do this. We call it box breathing. It's very easy. It's like a box. So you're going to breathe in for 4 counts. Then you're going to hold your breath there for 4 counts. Then you're going to breathe out for 4 counts. I'll stand behind the mic so people on Zoom can hear me. And then you're going to breathe out. And as you empty your lungs, you're going to keep it there for 4 counts. Okay, so deep breath in. And hold. And out. And hold. And try in through your nose and in. And hold. 2, 3, 4, and out. And hold. 2, 3, 4. And another one in. 2, 3, 4, and out. And hold. 2, 3, 4. Thanks. You can sit again. I do this. You know when a patient whose life you saved yesterday, who should be eternally grateful that they're alive, but instead they're complaining about the food menu? That's typically when I would do this. Not as pronounced, so they can't see it as much, but just to take deep breaths. That really brings you back into your body. We spend so much time ignoring our bodies. We ignore when we are tired. We ignore when we need to pee. We ignore when we need to eat. But that breathing really brings you back in your body, and it helps you not to say things that you're going to regret later. Next one. Determine what's important to you in your life. So imagine you are in a hospital now, 50 years from now. No, not now. 50 years from now, you're in a hospital, and I'm your doctor. And imagine I ask you, you know how we ask our patients, what are you proud of? What was your biggest accomplishment in life? What will you say? What was your biggest accomplishment? I'm sure it's not going to be that you worked 16 weekends straight, right? And you can also say, what's your biggest regret? What did you not do? And if I ask you, who do you want to be next to your bedside? Who do you want me to call? Think who you want to be there. And then prioritize your life now accordingly. We spend so much time and energy chasing things that doesn't hold value, that we don't even value. So it really helps to prioritize then and just shift your priorities accordingly. Next one, determine what sparks joy. At the end of the day, go and sit down and decide what you enjoyed. This looks different for every physician that I've worked with. And funny enough, most people don't even know. There was one physician who came to me, a male physician. He came to me because of physical things. Because of physical things, he had to quit his clinic because his health was not coping anymore. So he came to me, and when we really sat down, so he didn't really want help with burnout. He just wanted help with physical things. And then as we were working through this, doing this specific step, and I asked him, what sparks joy and what sucked the life out of you? He couldn't identify anything. And we really slowly worked through that every session. And at a certain point, he recognized that it's not that he hates being a doctor, which he told me initially. It's not that he hates patients, which he thought. It was actually that his clinic manager of over 20 years was giving him a very, very hard time. She's a strong person, ran the clinic well, but very negative and very micromanagement. He didn't really feel comfortable taking a weekend off or taking a week off or taking days off or golfing or doing things he enjoyed because of the way that she managed his clinic. And once he realized this, he could give her a very big retrenchment package, but then he could keep on working in his clinic. And so he's still working. He now does golf once a day. And so rather than being a great doctor 7 days a week, you can be a good doctor 4 days a week. So that's so for you to really try to reflect every day, what do you enjoy? What did you enjoy that day? And then also, who or what sucked the life out of you? For me personally, things that fill my cup are people. I enjoy people. So when I have a lot of work, or I try to be quick upstairs in the ward and I don't come to the physician lounge for lunch, then there's nothing filling my cup. And when I have to go to the grocery store, I don't enjoy going to the grocery store. That drains my cup. And I don't enjoy an untidy house. That drains my cup. So I need to put things in place. I must make sure I set my alarm and I come down to the physician lounge for lunch, that I connect with my friends. I must then, after I chatted with everyone, quickly do my grocery shopping online so that it delivers to my door. I must get help with my house. Then when I come home at night, my cup is full. Then I have energy to sit with my kids, to go to the park, to play ball, to do things, because my cup is full. So it really helps to identify what fills your cup. Next one. While you're journaling at night, start with a gratitude journal. So this is a big one. The happiest person on our planet at this point is Riccardo Matteo. This is a monk that sits somewhere on a mountain top, and he meditates on gratefulness, on happiness, or on gratefulness specifically. And that's very interesting to me when I read about him at first, because I personally don't think I would be happy if I'm a monk on a mountaintop, because the things that I think causes me to be grateful are material things, physical things, people. They have nothing, those monks, and they still have the ability to meditate on gratefulness, grateful for the sun that came up, grateful for their bowl of food. They're grateful for things. And then they found that same principle of neuroplasticity that we see in our stroke patients, where your brain can become stronger in certain areas that you stimulate. They've done these functional MRI studies on him more than 10 years ago, where they looked and they found that his happiness center is overdeveloped, so is all of his friends. And then they tried to kind of deduce from that, can we be made happy by meditating on gratitude? So they've done a big study in New York, according to his functional MRI findings, the whole study findings, and they took people like you and me in New York that has a full-time job, that's in the hustle and bustle, and they taught them to meditate for 5 minutes a day on gratitude. And those people, with time, their happiness scores went up. They become more pleasant, more enjoyable people. They enjoyed life more. And every person that I worked with who started on this gratitude journal, and I've been teaching this to my mental health patients here, who really doesn't enjoy life and they feel that everything is against them. If you find something in every day and you just write something small down, I can guarantee you, you are going to be happier 3 months from now. You can fill out any happiness questionnaire now, and after 90 days of doing that, fill out that same questionnaire and come back and tell me your score, because I can guarantee you, you're going to be happier if you practice that. And for today, for example, you can, even if there's nothing else, even if your job sucks, your family sucks, everything is horrible, you can be grateful for a free lunch. For the people on Zoom, you can be grateful that I am passionate about your well-being, and I'm really making it my mission to help other physicians heal from burnout. There is definitely something small that you can find in every day that you can go and add to your list. My next one is to have fun. This is a big one. George Bernard Shaw said, "We don't stop playing because we grow old. We grow old because we stop playing." And you might not know what fun looks like. but you'll find something. It can be something small, like putting on a fun song in the morning and dance when you get ready for work, or to go with your kids or your dog to the park and to kick a ball. If you really can't find anything to be, any way to have fun, maybe dusting off your guitar, coloring. But if you can't find anything, you can watch a stand-up comedy show. When you do that and you laugh, but like a proper belly laugh, your body secretes endorphins and all the feel-good hormones that counter all the cortisol that you've secreted during the day. Last step. This is a very important one. You become like the 5 people that you spend most of your time with. So really reflect on the people that you spend your time with. If you don't want to look like them after 5 or 10 years, then start spending less time with them and increase your circle of friends to include more amazing people, people that you want to be like. There was a big study that they've done on nurses with breast cancer. And they found that these nurses, they followed them for a very long time, for 10 years, and they found that the nurses who had a very small circle of friends were 4 times more likely to die from breast cancer than the nurses who could identify 10 or more close friends. And in this specific study, having a spouse or not, didn't really change their outcome, but their circle of friends did. And there was another study on men, Swedish men, that they did over 7 years, where they looked at cardiovascular disease and their risk of dying from a heart attack, or heart disease. It was specifically regarding heart disease. And they found with these men as well, having a spouse, and having a spouse is helpful. There's prostate cancer studies where people do live longer with a spouse. But then this specific one, having a spouse as well, didn't have any change in outcome, whether they died from a heart attack or not. But having a big group of friends was protective. And the people who had limited social connections, where their risk factor of limited social connections was just behind tobacco smoking. So in this Swedish study, your biggest risk of dying from a heart attack was smoking, but your second biggest risk was not having friends. Only after that, they got to your cholesterol level, your blood pressure, having diabetes, sedentary lifestyle. Those things came after, but the second biggest impact on their mortality was their circle of friends. This is quite significant. So to realize that and to value that, I'm also a busy mom, and before I've started with this wellness clinic, I've never really prioritized friendships because we always have work to do, always. But if you think with a big picture thinking, it is critical to really to invest in your friendships. And then the last one. They've done a big study last year at the University of Virginia. They took, with COVID, when people now for the first time realized, oh my goodness, we need social interaction, we need people, they started doing more and more research on friendships. And they've done this specific study where they took a group of students and they had them go up a mountain. And the first group of students would stand there alone in front of a mountain. They all had weighted backpacks. So they had to rate how steep they think this mountain is and how heavy they think their backpack is. Then they took another group of students and they paired them up with a friend. And the group of students who were paired up with a friend rated the mountain the least steepest and their backpack the lightest. So I would like to encourage all of you to really surround yourself with people that because we have mountains to climb in this life, unfortunately we do. But to surround yourself with people who you want to climb up that mountain with, people who will help you feel that the mountain is not as steep and whatever baggage you're carrying is not as heavy. So now it's really good time to strengthen and expand your circle of friends and to build on your friendships for the year to come. Thank you very much, everyone, for your time. My heart's desire is that you take one thing from today's talk, write it down, and go implement it. That would really mean success, and it would be then a good investment of your time. Thank you. Any questions? We have lots of time. Does anyone have any questions for me?
Hey, Daniela, can I ask a question? It's Simona.
Simona, yes, anything.
that you are passionate about our well-being. It is very, very comforting to hear that. And the 10 points that you listed here and the examples with the clinical trials and stuff, very convincing. I am for sure going to look at doing one or more of those. I am interested in your wellness and the, I guess what it is, clinic, and I think many of our patients or in my specific specialty, caregivers of my patients, because I'm a geriatrician, right, would benefit from an assessment. Is this OHIP covered?
No, unfortunately it's not. You know, what's really been, so in family practice, I've tried to teach these same principles and I've never really been very successful with it. Then when I've gone through my training, and I couldn't understand why people can't just implement this, because I implemented it and I'm happy. Just do it and you'll be happy. Then I did some training through the Institute of Functional Medicine, and I got introduced to the principle of health coaches. And health coaches are not covered. And that's why my clinic is so very successful, because people just see me once and maybe again 3 months later, but then they see their health coach every week. And that health coach is private. And that health coach is really what makes the clinic successful. But then what I've been trying to do is, and my heart's desire really is to open up a big clinic in Oakville with lots of resources where we can look at what is OHIP covered and to really have it. And I'll talk to you again, hopefully in a year, and say, yes, it's OHIP covered, tell all your patients. At this point, well, it's only me, and I have limited time so that I don't go through burnout. What I've been trying to do when people have something that I see, oh, people struggle with this again and again, what I would do is that's why I started the podcast, is I will tell people when everyone says, oh, they can't sleep, then I'm, okay, good, go and listen to my sleep podcast. Everything is there. Or when people say that, whatever, I've had 2 podcasts with other physicians on burnout specifically. There's these common things that people deal with. So no, unfortunately at this point, it's not OHIP covered, but I'm trying, and I started with YouTube videos as well, to have this information more accessible and more out there for people to see. So if you know about something, specifically, Simona, tonight I'm specifically going to give a talk about cognitive health and lots of studies that they've done specifically with dementia, how dementia can, the mean onset of age would be later in people with better, who are more integrated in their community and with more friends. So there is a lot of research and lots of interesting things out there. Yes.
That's amazing. That's wonderful. I'm going to have a look at the podcast and maybe I can work with you on one on cognitive.
Oh, for sure. Oh, I would love that, Simona. Yes, let's do that. Yes. Yes, that'll be good. Thanks.
Clinic, everybody is always surprised if they've never heard of it and they never will. So I think it's a great way to have information out there.
Yes, so especially if it's things that you find that you tell every patient, what you can do is if we record that podcast, you can tell them when they make the appointment with you, you can say, oh, and here's the link, listen to this before you see me. So that they had some time to think about all the things that you tell everyone, that they've heard it by the time they see you. Oh, for sure. Yes. Good. Any other questions? Then thank you, everyone, for coming. There's still food left. Nothing else. You are all very rested. No one with burnout here. Good. Good. It's a very good book, that book from Gabor Mate, When the Body Says No. I really recommend you all read it, because there is a lot of things, and after I read that, I started recognizing that in my patients. You know, patients that had this autoimmune disease for always. Why are they coming to hospital now? And then when you really sit down and just spend 1 or 2 minutes extra, you find out, oh, it's because this one died, this, you know, and this is what's triggering the whole body to just not cope anymore. Thank you, everyone. Take care.